Thanks, Karen. Hey, everybody. Thanks for joining us today. I'm really thrilled to be able to talk to you about the 2021 World Index of Healthcare Innovation. This is something I've been wanting to do for a long time, and we premiered this last year. This is the second year that we've done this World Index of Healthcare Innovation. And as I'll get into today, we feel there are a lot of reasons why it's really important to revisit the way we think about the U.S. healthcare system in relation to other countries that both we can learn from, and perhaps they have some things they can learn from us. And I'm pleased to be joined by two of our scholars, Gregg Girvan and Mark Dornauer, who played a huge role in putting this project together. So thanks to them both, and you'll hear from them both a little later. So I'm going to share my screen here so you can see some slides, which we're going to be happy to share with any of you who want to take a look at them later. As a reminder, if you have a question, you can just throw it in the chat or the Q&A functions in Zoom, and we'll get to it after we're done going through our initial remarks. All right, so I'm going to share my slide now. Here we go. All right, so as Kara mentioned, we are the Foundation for Research on Equal Opportunity. If you're not familiar with FREOPP, we're a think tank that focuses on achieving progressive policy outcomes, expanding economic equality, but doing so through free enterprise, technological innovation, individual liberty, and pluralism. So we're trying to find ideas that both Republicans and Democrats can embrace and think of as championing their values. And we only focus on ideas that can improve the lives of Americans whose incomes or wealth are below the U.S. median. And we're a 501c3 nonprofit. So we start with the project like this by asking, okay, what is it that we want in a healthcare system? You're going to try to say the U.S. healthcare system is better or worse than any other healthcare system. And what should we want the U.S. healthcare system to look like? And here's how we approach this question. Obviously, everyone has an opinion on this. Here's how we approach it. We say, well, first of all, we want a healthcare system in which as many people as possible are healthy, don't need to use the healthcare system. And if you have to use the healthcare system, you're going to get great care and great health outcomes if you turn out to get sick. We think there should be a system in which everybody has the maximum amount of choice, both choice in your insurance plan, choice in your doctor, choice in where you get treatment. But obviously, you're not going to have choice unless those choices are affordable. If you can't afford the choice, it's not really a choice. And choice also includes things that are new, right? New technologies, new treatments. So we think of choice, we would argue, in a pretty holistic way. Then science and technology, obviously this relates to the choice piece as well. Countries should nurture ecosystems of innovation in both the treatment of disease and the delivery of care. And finally, fiscal sustainability. You know, it's not just important how expensive or inexpensive your healthcare system. What matters is particularly how much of that expense is paid for by the government in ways that the government is not going to be able to sustain in the future. If you got a healthcare system that seems to be working well today, but 10 years from now it's going broke, then you really have a problem on your hands that we think others have not always paid full attention to. So I'm going to highlight three previous attempts at ranking healthcare systems around the world that get a lot of attention in the press and in the academic community. One of the most famous is the World Health Organization 2001, literally ranked every single country in the world. They ranked the U.S. 37th behind Oman, Colombia, Saudi Arabia, Morocco, Dominica, Costa Rica. It was kind of a random list. And, you hear people say, well, the U.S. system is so terrible that even the World Health Organization thinks Oman has a better healthcare system than U.S. That's one way to look at it. You could also look at it and say, well, maybe the World Health Organization's model or their methodology was not that robust if they're ranking some of these countries like Colombia, which at the time was going through a civil war over the healthcare system of the U.S. And they emphasized by their own reckoning fairness and health outcomes and the responsiveness of the healthcare system. Another one that's better, in my view, is the Commonwealth Fund. The Commonwealth Fund every few years ranks 11 countries, not all 191 or how many ever countries you want to say we have now, but just 11. And in their most recent rankings, they ranked the UK first, Australia second, and Netherlands third. The US ranked last. And a big part of what the Commonwealth Fund criticizes about the U.S. is a lack of equity. They say we have a high uninsured population, disparities in the affordability and health outcomes, and they ding the U.S. for that. So if you're focused on the equality of access to healthcare above all else, that's something the Commonwealth Fund emphasizes, and they say the U.S. is the poorest on that. The Journal of the American Medical Association published a study basically cataloging and analyzing data from the OECD, the Organization of Industrialized Countries around the world, that doesn't include every single industrialized country, but includes many of them. This particular article ranked 11 countries in particular, and didn't really rank them overall, ranked them on all sorts of different criteria based on the OECD data, and depending on the particular issue, the U.S. ranked highly or lowly, but also kind of the same set of countries that the Commonwealth Fund typically looks at. What are some of the limitations of those studies? Well, the first, and I sort of implied this a little bit with my last slide, there's a de-emphasis or an absence of relevant criteria. In our view, these other comparisons of healthcare systems largely ignore measures of scientific and technological innovation, which is obviously incredibly important. If the COVID vaccine situation is one of many examples in which having an innovative system really matters. Choice really matters, and fiscal sustainability really matters. It matters, again, whether or not your system is going to be able to continue in its current form in 10 years, even if it's good today. Important countries are often excluded from the analyses that we've seen, particularly the JAMA and Commonwealth Fund studies I mentioned before. You see a lot of people use the OECD universe of countries as a group to compare. But very important countries that are worth looking at are not part of the OECD, notably Singapore, Hong Kong, Taiwan, and the UAE, all of which are wealthy countries with meaningful populations that have very interesting healthcare models that generally get ignored by scholars who just basically pull down the OECD data and don't try to analyze things themselves. And then the final point is that cross-country comparisons are often inaccurately done, particularly the OECD data set has a lot of stuff in it where one country reports the data one way, another country reports the data another way, and those two things don't line up. To give one example that I'll highlight, the OECD's definition of public health insurance includes a lot of private health insurance if you're required to buy private health insurance. So imagine in the US, if you live in a state that requires that you buy auto insurance, you buy auto insurance typically from a private insurance company, right? But according to the OECD definition, that's actually government insurance because you've been mandated to buy it, which for our purposes doesn't make a lot of sense. So we actually want to make the distinction between private health insurance and government-run health insurance, because that's obviously so important to the debate in the United States. So if you actually look at the real public subsidies per capita of healthcare, here's what's kind of crazy. The US actually spends more subsidizing healthcare per capita than any other country in the world. That's Medicare, Medicaid, the tax exclusion for employer-sponsored health insurance, Obamacare, and a bunch of other things, right? Whereas Germany, a country that you normally think of, a lot of people in the US think of as sort of a single-payer country, it's actually not. It's a country where everyone gets private insurance through nonprofit cooperatives, effectively. So I mentioned that the WIHI includes a lot of these Asian countries that are typically neglected. So those countries are Hong Kong, Israel, Japan, which sometimes gets included in cross-country comparisons, Singapore, South Korea, Taiwan, and the UAE, along with all those European, North American, and Australia and New Zealand that you typically see. So here's some of the things that we looked at. We looked at 4 dimensions, which we weighted equally: quality, choice, science and technology, and fiscal sustainability. They each got a 25% weighting. And what these sunburst charts are showing you, and there's an interactive version of this on our website, it gives you a sense of what the categories were and what percentage weighting they got. So you can see here in the quality dimension, the 4 sort of sub-measures were patient-centered care, pandemic preparedness, measures of preventable disease and infrastructure, and then underneath those there were subcategories that fed into those major 4 scores. And here's some things that I would point you to that we looked at that are typically neglected in international healthcare comparisons. One is economic growth. there's a strong, strong correlation between GDP per capita, the prosperity and wealth of a country, and the health of its citizens. And yet you don't see a lot of people focus on that as a criterion of population health. It actually matters whether or not you live in a country whose economy is growing or not. So that's something we looked at in the WIHI. Another thing is the pandemic response to COVID. Obviously, and we can look at a lot of things about public health, but at the end of the day, looking at the way countries responded to the COVID-19 pandemic, we think is a really good way to look at whether countries have robust public health systems or not, because that's what the public health system should do. It should prevent outbreaks of public health threats like pandemics. And we really emphasize patient-centered care. There are other surveys like the Commonwealth Fund survey that do look at patient-centered care. And we borrowed a lot of their data for our own work in this area. We really emphasize the importance of a system in which you don't have to wait to see a doctor, where you have some voice and decision-making in terms of the way your care is delivered to you. We also obviously emphasize choice, the freedom to choose both your insurance plan and where you get your care, and access to new treatments. Affordability, we see, as I mentioned, as another element of choice. Science and technology. So we looked at things like, well, the percentage of Nobel laureates that your country both received in terms of people who live in those countries when they got the Nobel Prize, and also where they were educated, even if they ended up in some other country. We look at things like citations in the academic literature for research that's being put out of your country. We look at R&D investments, new drugs approved, patents, all sorts of things, digital healthcare. So do you have a digital system for health records and things like that allow improvements in healthcare delivery? So these are some of the things we looked at to see, do you have a robust ecosystem for discovery, development and marketing of new treatments, and technologies used in the delivery of care? And then finally, fiscal sustainability, which is pretty simple in terms of the way you look at it. We can look at public health spending per capita. Is that growing or steady? And is the growth overall in public debt in your country unsustainable? Because the healthcare is obviously only one component of your overall debt and deficit picture. And so here are the top 5 countries under in the WIHI system. We looked at 31 countries. Here are the top 5 in overall rankings. And what's interesting about all 5 of these countries is they all have universal coverage through private insurance. So you're used to hearing that the only way to achieve universal coverage is through single-payer healthcare, where the government is the only insurer. These 5 countries all achieve universal coverage through private insurance. Number 1 is Switzerland. In Switzerland, which has the maximum freedom of choice and insurance plan, everybody chooses their own individual health insurance plan, just like you would choose your car insurance or your life insurance or anything else. And on a per capita basis, Switzerland is number 1 in producing medical advances, new treatments in their country. Now, they have a lot of big companies are headquartered in Switzerland, like Roche and Novartis and a number of the big medical device companies. So in terms of per capita, punching above its weight, Switzerland is number 1 in producing medical advances, and number 1 in quality, number 3 in choice, as you see, number 2 in science and technology, and 6th in fiscal sustainability. Netherlands is another country with a highly competitive all private insurance market, and they rank number 1 for patient-centered care. Number 3 in our survey was Germany. Germany is number 1 ahead of the United States in access to new treatments. We're used to hearing that, well, only in the US can you get new treatments when they come out. Well, Germany is actually really good in this regard as well, actually better than the US. And one thing that's really remarkable about Germany is their record for fiscal sustainability. They have a balanced budget amendment in Germany. So you basically can't have budget deficits in Germany. And that means their costs are much better controlled in Germany versus the United States. Ireland is number 4. Ireland is doing a great job in tackling preventable disease. And a big part of why is robust economic growth. Ireland is consistently the fastest growing country in Europe, largely because they have the best tax system, which is also why a lot of global pharmaceutical companies and biotech companies are headquartered in Ireland, because they have the lowest corporate tax rate, or among the lowest in Europe and in the world. And 5th is Israel. Israel ranks number 1 in Nobel Prizes per capita, And number two, in prevention and patient-centered care, they also have a universal private system. There are four main insurance companies in Switzerland that are modeled somewhat similarly to Germany's that compete for your business. So the US actually ranked sixth behind these five countries. And the thing about that's interesting about the US is the US did awesome in certain areas and terrible in others. So US was far and away the winner in science and technology. We have the most Nobel laureates. We do the best academic research. We have the most innovative companies. So we dominated in the category of science and technology, but we were only 20th on choice, and we were 30th out of 31 in fiscal sustainability. Why? Because our system, as I mentioned in that chart I showed earlier, is actually the most expensive public subsidy system in the world by a long shot. We give almost everybody in the US subsidized care in one form or another, but the cost of that care is way higher than every other country. So we end up spending more in terms of government spending than any other country. And that spending continues to grow in a way that's profoundly unstable in terms of our debt and deficit and the growth of our debt and deficit over time. And while we rank highly just behind Germany in access to new treatments, we rank last, dead last in the affordability of coverage. And again, you don't have a real choice if you can't afford the treatment, if you can't afford the care. If the only cars that are being sold are Bentleys and Maybachs, right? You only make $20,000 a year, you're not going to get a car, right? So similarly here, that's basically the way our healthcare system works. Our healthcare system is incredibly expensive, and that means a lot of people are priced out of it, even if theoretically they might have choice. And we don't always have choice, right? Like if you're in the employer-based system, you don't choose your health insurance plan, your employer chooses it for you. So I think a lot of people don't realize how poor America is on healthcare choice, even though we think of ourselves as a country that does well on choice. Now with that, I'm going to hand it off to Gregg to talk about what the U.S. can learn from some of the other countries that weren't in the top five, but are really interesting.
Thanks, Avik. Appreciate everybody's work on this project as well. It's been a long slog, but I think I'm just very appreciative of everybody's help to help put this together. I want to touch on a couple things. First, that overall, the biggest point I want to make in terms of WIHI is that it's not really about beating the other countries in the rankings overall. It's not really the purpose of what we're trying to do here. What we're trying to do is figure out ways that we can learn from each other, to figure out what each country's strengths and weaknesses are, and see what can be applied elsewhere, including in the United States. And I'd like to touch on something that Avik mentioned earlier, namely that one thing that sets our index apart from prior efforts is the fact that certain additional countries are added in, ones that are often overlooked. And even in the studies like the Commonwealth study, they don't include a country like Portugal. So if we look at a country like Portugal, it ranks below the US overall at number 17 versus the United States being ranked at number 6. But there are certain things that we can learn from them. One of the things that's really interesting about Portugal is that in terms of quality, they rank higher than the US, despite the fact that they spend less on healthcare. And in particular, if you dig down deep into the numbers, you find that Portugal does a really, really good job in preventing hospitalizations and keeping people out of the hospital. So their preventative care is very, very good. In fact, it's the best in the entire index on that particular measure. And, you know, despite the fact that Portugal has some debt issues, their growth in public health spending is not as severe as it is in the US. And so even though they're in a little bit of a hole in terms of their debt and deficits, they have managed in recent years to begin to control that some. So that's one country that the US can learn something from. If you look at a country like Singapore, Singapore is another good example of these countries that often get excluded. and ranked at number 12. Again, it's ranked below the US. But if you look in terms of choice, and in particular, how their system of national HSAs enables people to have more choice in terms of how they spend their healthcare dollars, that's something that places Singapore ahead of the US in terms of that dimension. And then a further example would be Taiwan. Taiwan ranks number 13 overall in the index, again, below the United States, but they do certain things really, really well. If you look again, in terms of choice, they rank higher than the US. But one of the other things that they do that you may not get from sort of the top line statistics is that they punch above their weight in terms of the science and technology rating because of a system that they have in place that has national electronic medical records, where they basically every citizen carries around a chip card that has their pertinent healthcare information on it. And these are things that have shown to help them in crisis times, like with the COVID-19 pandemic. It allows the country to track where infections are occurring and to be able to clamp down on those much quicker than we have been able to in the United States. And so again, this really highlights that it's not about the overall ranking. It's about what each country does really well and what we can learn from them and implement in our own system.
Great. So Mark, let's have you talk about the pandemic response. That's something you've spent a lot of time on.
Great. Thanks, Avik. And thanks everyone for taking the time to join today. With the time I have, I wanted to quickly talk about one element in the broader WIHI analysis, which is pandemic preparedness and response. Now, it's in our nature to rank and compare countries regarding the COVID-19 pandemic. And for a majority of 2020, it seemed as if countries like New Zealand and Australia could do no wrong, and conversely, the United States could do no right. But over a half a year into 2021, that COVID preparedness narrative no longer holds true. So right now, New Zealand and Australia look a lot more like the rest of the world than the paradigms that they were heralded as just maybe 6-7 months ago. So in Australia, and particularly Sydney, COVID-19 cases are spiking. Last week, the Australian state of New South Wales declared an emergency after an outbreak of the highly contagious Delta variant. And now, while Australia and New Zealand had enjoyed a, quote, quarantine-free travel bubble, both countries saw that bubble burst over the last 5 weeks as cases are out of control. Which raises the question, why? And really the major reason for that is obvious. Australia and New Zealand hold relatively low vaccination rates. And actually, Avik, if you could sort the slide according to vaccinations per 100 people, that would be great. Thank you. So as of yesterday, around 31% of all Australian adults were either partially or fully vaccinated. Similarly, in New Zealand, only around 19% of the adult population was vaccinated. Now, for comparison, let's take the UK and the US, who have been just hammered in the media for their response to COVID. The United States currently has around 56% of its adult population either partially or fully vaccinated, and the UK is slightly above that at about 69%. And just to give even a broader comparison, the world is only about 28% partially or fully vaccinated, and at the high end, the UAE is around 78% of either partial or full vaccinations. So what's the main point? The main point is that the American system is imperfect, but its excellence in science and technology and innovation, and specifically its pharmaceutical might, led to a broader supply of vaccines that allowed for better access to a new treatment that, in this case, is incredibly life-saving. So just a moment ago, Avik helped sort the chart according to vaccinations per 100 people. And when you do this, you see that the US ranks 4th and the UK 3rd, while New Zealand 28th and Australia 26th. And that was 3 months ago. The gap between that has widened exponentially so, in less than 90 days. So I think what's really interesting about that point is that the various metrics within WIHI are really interconnected, and the nature of ranking health systems is terribly complex. But I think that's why WIHI in its existence is really important. You have to evaluate these countries holistically and understand that no single country really figured out healthcare perfectly. There's always going to be trade-offs, and there's always lessons that can be learned from different nations, and especially the nations that I think Gregg had just mentioned that often get overlooked in these major academic research projects. So anyways, with that, I'll yield my time and look forward to any questions.
I'll just, thanks, Mark. I'm just going to mention one thing so that as people are looking at this table here, so you might wonder, I got a question, why are some countries higher than 100 in their vaccinations per 100 people? And the thing to understand about this data is it's how many doses of the vaccine per 100 people. So many of the vaccines, as you know, require 2 doses. So a perfect score is something more like 200, not 100. So if you want to get some estimation of the percentage of people who've gotten 2 doses, you could divide by 2, but it's obviously not that simple because some people have gotten 1 dose, some people have gotten 2 doses. So vaccination doses per 100 people is the metric that you're seeing a lot of people use to look at this. And that's why that's in there. Well, I'm just going to say one more thing before we go to questions, and that is that if you want to learn more, we have got a ton of resources online, including detailed explanations of the methodology, the background, country by country reports about each country's healthcare system that was ranked in the survey. And also we have a whole page and series of white papers on what the United States can learn from what other countries do and how the United States could have a better healthcare system that reflects some of the principles that we've highlighted here. So with that, I'm going to stop the slides and we will go to questions. All right, so I see a couple questions in the chat here. Here's one. Has the U.S.'s pandemic response improved or declined over time? Mark, you want to handle that? We have published some rankings over the time, and it's interesting. I'd say that the U.S.'s ranking was kind of in the middle of the pack. I think the first time we did this, it was 19th. Then it went down to something like 25th. And now it's back up to 16th or 14th or whatever it is now. So it has gone down and up as the fatalities kicked in and then the vaccinations. Go ahead, Mark, if you have any other thoughts.
Yeah, I think parlaying off of Avik's point, I would say to answer the question directly, yes, I mean, the response has improved, but I don't think it's as simple as just a change in leadership led to that. I think, countries, as the pandemic evolved, countries figured out how to deal with it better. And I think what's interesting about the metrics we used, we took into account a lot of different factors of how to respond to COVID. And so we looked at lockdowns, we looked at fatalities, we looked at vaccinations per 100 people. And, we are improving. I think the trajectory looks positive, even as there's a lot of concern about the rise of the Delta variant. I think the United States, broadly speaking, has learned that there is a balance, I think, to protecting the public health, but also the economic welfare of the country. It's obviously an imperfect balance and it'll shift as different variants rise to the forefront. But, I think structurally, the United States is in a much better place now than it was even 7-8 months ago.
Great. We got a question on which of the top countries would serve as the best model for the U.S. Healthcare system. And what we've expressed is that Switzerland of the various top 5 countries, and I'll put up the top 5 countries slide in a minute here, that Switzerland is the best model for the U.S. So we have things to learn from everybody. Switzerland is the best, and the reason why is that Switzerland is the country that is the closest to the United States in terms of what we could evolve into, and also the preferences of Americans. So as Americans, we really want choice, we value innovation. And those are the 2 things that Switzerland does really, really well. They have universal choice where everyone chooses their own plan. That's something that in Medicare Advantage works really well. We argue that, one of the reasons we call our health reform plan Medicare Advantage for All is we think that everyone should have the choice of their own health insurance plan. And yes, we should provide financial assistance to those who need it, but not to those who don't. And that's another thing that Switzerland does well. They only subsidize coverage for the lower quartile of their population economically. People who are in the upper middle class and the wealthy, they don't get subsidies to buy their health insurance. The expectation is you have enough money, you earn enough to buy your own coverage. And that alone, just doing that, means testing the subsidies so only vulnerable and low-income people are getting them, massively improves the fiscal sustainability of your system. So Switzerland, you've got a high growth, low tax environment. You've got a massive, innovative pharmaceutical ecosystem. You've got great science. You've got a fiscally sustainable system, and you've got free choice of doctors and plans and hospitals and treatments. It's pretty much everything that Americans say they want, but in a package that's much more sustainable. So we look to Switzerland more than anywhere else. Okay, next question. Are there any policies currently in Congress that we should consider to move to a healthcare system that values choice? Well, the one that I'd highlight there, and this is something that you can see on our website if you go to freopp.org, there's a bill called the Fair Care Act of 2020, which was introduced in the House by Bruce Westerman of Arkansas and in the Senate by Mike Braun of Indiana. And that bill is a lot of their work is based on some of the things that we've just been talking about and that we've worked on. And this is the basic idea. It's to improve choice and competition, and also reform the way subsidies work in the United States so that we could move to a system that's universal in terms of coverage, but also one that's much more fiscally sustainable and one that's much more innovative and one that's more pro-choice. So how would you do that? Well, Medicare Advantage works really well. So in the Medicare population, our argument is let's make more of the Medicare system look like Medicare Advantage as it gains more and more share of the senior market. With the employer-based system, which half of Americans are on, we really need to unlock that system so that workers get to choose their own health insurance rather than having it dictated to them by their employer. And that's something that we think needs to change. We want workers to have that autonomy and sovereignty over their own healthcare choices. And for the low-income population, we should make Medicaid look more like that free choice system. The Affordable Care Act has some of those qualities in its exchanges, but not enough. So we'd reform the Affordable Care Act exchanges, make them a lot better, a lot more choice, a lot more affordability, and then integrate Medicaid into that system. So that's the kind of the quick summary of a bill that we think is very attractive and reflects a lot of these principles. Question we got, are we working with anyone at FREOPP in Congress on healthcare reform? We work with lots of people in Congress. Basically, we'll take the calls of anybody who wants to talk to us and vice versa. I highlighted this bill from Bruce Westerman and Mike Braun. There are a half dozen co-sponsors of that bill. There's a lot of other things we've worked on the Democratic side. We've worked with some of the Democratic leaders in the Senate on drug pricing reform, which is a really important topic that we feel doesn't get enough attention among the free market community. So I would highlight some of the people on the Senate Finance Committee in particular, both on the Democratic and Republican side, as being really good on that topic. But we work with everybody we work with the key committees. We work with individuals. You know, what we've found is that a lot of the people who are doing the most interesting and creative work in healthcare reform in Congress are people who aren't on the committees. They aren't on the traditional healthcare committees that you would expect. And part of the reason why is those healthcare committees get drowned in lobbyists who try to basically quash anything that would really lower the cost of care in America. So people who are outside of those committees tend to be the ones who have more ability to be creative in their ideas. Another question. Since Japan is last for fiscal sustainability, what will it take for them to turn around? How close is the U.S. to reaching Japan's status? I mean, we're well on our way. So Japan's overall debt to GDP ratio is something like 230%, something like that. We're at about 115, 120%. We're headed there. So we're not where Japan is yet, but we're getting there. I mean, Japan has had 20 years, almost 30 years now of stagnation, economic stagnation. And their demographics are getting worse. They're getting older. Their population is declining. So you have all these retired people who have healthcare needs, and you don't have a workforce that's paying the taxes to sustain it. So the Japanese system is getting worse over time, and the U.S. is headed there, right? We've got our baby boomer population that's getting older, that needs more healthcare. and we're not generating the tax revenue from economic growth to sustain that, it's a big problem. We really got to get our healthcare entitlements under control. So this is a problem, and you know, you can't do it by simply just cutting spending, right? You have to do it by means testing, by making the subsidies that we spend more progressive, more oriented towards vulnerable populations. And you also have to reduce the underlying cost of healthcare, what it costs to go to a hospital in the US, what it costs to get drug treatment in the US, what it costs to get treatment from a physician or surgeon in the US. If you don't tackle those underlying cost problems, you'll never tackle the cost of government subsidized healthcare in America. Okay, we got another question here that I have to pull up. Let's see. Question is, do you believe there's any potential the House and Senate pass any aspects of the Fair Care Act, the bill that I was mentioning earlier? The answer to that is actually there are a number of pieces of the Fair Care Act of 2020 that were passed into law over the last 12 months. And in fact, my understanding is that those members and the other members are working on the new version of the Fair Care Act. That's one of the things they're having to work on is which pieces to take out because they've already been passed into law. So there are a handful of things, handful of reforms that have passed into law that are part of the Fair Care Act, but the bulk, the core reforms are still needing to be passed. And the goal is basically, you know, if you look at the history of the legislation, big ideas, big pieces, big reforms, they don't happen overnight. It takes, let's say, 10 years from the time a bill first gets introduced, and this bill was first introduced in 2018, to when it finally becomes law, because it takes a long time to get everyone's heads around it. Healthcare is obviously a very politically challenging issue, not just because it's partisan, but because there are risks, right? When you change healthcare, it affects tens of millions, if not hundreds of millions of people. So members have to get the comfort around a particular policy idea to make sure they can feel strongly that it's going to make their constituents better off. And that takes time. So it takes time to walk people through all that. So, but we are making a lot of progress on that. The members are making a lot of progress on selling people on the importance of this kind of reform. Okay, next question. What is the correlation between the U.S.'s healthcare spending and our high ranking in science and technology? This is a very interesting question that Gregg Girvan on our team has been doing a lot of work on. I'll tee you off by just saying that a big part of our high ranking in science and technology is our academic centers, right? Our university research, the Nobel Prizes, the academic citations. That's all driven by NIH funding of basic research at universities, not so much by what we spend on the cost of hospital care, the cost of drug care. So they're almost in that sense very different. But Gregg, do you have any thoughts on that?
Yeah, the one thought that I would add to what you've said is that, you know, let's take prescription drug pricing, for instance. Some research that we've been doing recently has been looking at this tie between basically R&D spending and the level of innovation that produces. And there's this common thread that's always discussed whenever we're talking about any kind of drug pricing reform, that the pharmaceutical companies sort of rise up and say, well, if you do that, then it's going to harm innovation, and we're not going to develop the latest and greatest drugs that will come down the pipeline. Well, according to our research, there's a significant amount of, in terms of where the R&D spending is occurring in terms of clinical trials, and also in terms of the newest sort of the novel drugs or the breakthrough drugs that have come out, ones that are truly affecting patient populations, and ones that are new in terms of how they treat a disease or treating a disease that wasn't treatable before. When you look at those types of drugs that are being developed, there's a significant portion of them that are developed by companies that are not even profitable, that have red balance sheets, and they're developing these drugs anyway. They're the ones that are the actual innovators. And so this idea that you know, pharmaceutical companies have to charge these high prices in order to pay for R&D just isn't supported by the data in many, many cases. And so this idea that our system is fiscally unsustainable because we're spending all this money in science and technology, it doesn't really correlate. What we're really seeing is that what's driving the fact that we're having fiscal sustainability problems is because the price of healthcare is really high. And we find that the price of healthcare is very loosely, if not really tied at all, to how much we're spending on R&D. And so it really just has to do with the fact that whether it's hospitals or drug companies, when you look at the way the system is structured, they're able to charge those prices. They'll charge whatever prices that the market will bear. And that's the market we have in the United States right now, is a system that drives towards higher prices. When you look at the level of consolidation that's occurring in the hospital markets and that giving them more pricing power over insurance companies, for instance, when you look at what's happening in terms of the pharmaceutical industry and all the protections that the government has erected around the development of new drugs, no matter what you look at, it seems like wherever you look in the United States healthcare system, it's totally built to encourage these higher prices. And that's what's driving the fiscal instability in the United States, or at least it's one of the main factors.
Great.
And, one thing I just wanted to parlay on to Gregg's comments. I think what's interesting too is, as we talk about spending and the correlation with innovation, Novavax is moving into phase 3 of its COVID-19 vaccine. And it looks like that'll be awarded approval like either the end of this year or beginning of 2022. And that vaccine is what's going to be spread out to New Zealand, Australia, lots of Asian countries. And I think it's important to note, that received a $1.6 billion federal subsidy, I believe from BARDA, earlier in the pandemic. So, we are helping subsidize, a freedom from the COVID-19 virus based on our strength of innovation and research.
Another point that you're reminding me of, Mark, is that one of the arguments you hear in the U.S. healthcare debate is, well, we can't have price controls on drugs because that would harm innovation. Well, that there may be some merit to that argument. We can debate that now or another time. But what's interesting in the vaccine case is the vaccines were all purchased by the government, right? The Operation Warp Speed pre-purchased at a government negotiated rate the vaccines. And obviously, the manufacturers of the vaccines found those prices attractive enough to manufacture hundreds of millions, if not billions, of doses. So it's not necessarily true that a government dictated price prevents innovation, at least in this particular unique case. One other thing I should mention about the vaccines is we tend in the U.S. to take credit for the vaccine development, and we certainly have our share. But we should remember that the Pfizer vaccine, at least the one that's often called the Pfizer vaccine, was actually developed by a German biotech company called BioNTech. And actually the CEO of Moderna is a French guy, a French entrepreneur, for better or for worse. So there are other countries that have chipped in to the vaccine innovation that we're seeing in the U.S. and elsewhere. All right. While we have a little bit of extra time here and no questions in the queue, Mark, let me throw it to you. You spent a lot of time on this project. What other things besides pandemic response struck you about about our findings? I'll put the table back up while you're thinking. And,
Sure.
And Gregg, if you've got any other thoughts, feel free to chip in as well.
Well, I think in 2020, that was our first swing at the WIHI analysis. And I was responsible for writing up summaries for a number of countries and helping with research for about a third of the countries on the list. Now, when 2021 came around, a lot changed, right? The pandemic progressed and systems inevitably ebb and flow in their effectiveness for increasing patients' health. But what was really interesting to me, and I think Gregg and Avik were really instrumental in taking a really discerning look at what we did in 2020 and how to weight different WIHI elements and even the metrics within those WIHI elements and how they aggregated more broadly into dimensions such as patient choice, quality, science and technology, and fiscal sustainability. So the reason I mention that is even for the countries that I had worked on in 2020 and then coming back around 2021, what was most interesting to me was there were a little bit of shuffling between the 11 to 12 countries I was looking at. And I thought it was really interesting how just the way that we thought more critically about how to rank these countries and how to weight different aspects of what they do well and conversely what they do poorly at, really did change their standings. And I think that's important for an analysis like this or others who try to attempt a similar analysis is healthcare evolves, public policy evolves, and I think this project evolved with it. And I think that's, quite frankly, one of the strengths of WIHI.
Yeah, one of the things you're highlighting, Mark, is that with any index, any project that tries to rank countries or states or whatever on any topic, there are judgment calls involved, right? You're making, even though there's a lot of numbers on this table that I'm showing everybody, each of those numbers is the result of judgments in which we say, okay, here are the measurements we're going to try to use that we think are important to consider whether countries are performing well or poorly relative to others. So any index you see requires a certain amount of judgment. That's why at the beginning of my part of the remarks, I emphasize that, right? Like there are a lot of different rankings out there, and they all exhibit some sort of judgment about what they think is important. We think that we would say the WIHI project, the World Index of Healthcare Innovation, is unique in really emphasizing and understanding the importance of innovation in the quality of a healthcare system, fiscal sustainability, and choice. Three things that tend to be de-emphasized in the others. Other rankings do look at health outcomes. They do look at whether a country has universal health care or not. And again, they've dinged the U.S. for that in the past. But there are a lot of other things that matter in healthcare besides universality. If universality was the only thing that mattered, then a lot of countries on our list would have done better than the U.S. But if you're universal, but the outcomes of your healthcare, the innovation of your system, and the choice you have and the sustainability of it are poor, we think that matters as well. And that's why you see the results here. Gregg, any other thoughts that you've got?
Yeah, so going off of what everybody has said just now, one of the things that was, I think, a really great improvement over this year's version over the prior year is we took a really critical look at what it means to have access to new treatments. In the prior version, we had looked at, okay, well, do you have access to these drugs that are considered innovative? But one of the things that we included this time around is whether countries have access to generic medications at that affordable price or biosimilars. And so when you look at the rankings, access to new treatments, like you had mentioned earlier, Avik, saying that Germany was number one, US was number two, that may cause some people to pause and say, well, hey, the FDA most of the time approves the latest and greatest before anyone else. And they're usually introduced in the US before anywhere else because that's where the drug companies can extract the highest price. But what those analyses fail to recognize is access to something like biosimilars. And we've done research on this as well, where we've looked at the fact that the US lags behind Europe in terms of the approval scheme and mechanism to get biosimilars to market quickly. The US is really struggling to do that and is really playing catch up in regards to Europe, so when you look at Germany ranks number one in terms of access to biosimilars. And that helps drive up their ranking in terms of access to new treatments. So those are some interesting things that really cropped up this time around as we took a critical look at the 2020 version of WIHI and really took, I think, an even broader look at some of these measures to really improve the index and to really grab a more accurate picture of what's going on in each of these countries.
Yeah, it's a great point, and we welcome anyone out there who's got feedback for us on things you think that we didn't consider enough or consider too much or are off our radar. We're always looking for ways to refine this analysis and improve it in future years. We do intend to do this either every year, but I think we'll do it every year because there's just so much data to look at and so many refinements to make. One thing, we talked, Gregg, you talked about some of the countries that otherwise wouldn't get a lot of attention from others. One I want to mention that wasn't on your list is the United Arab Emirates. the United Arab Emirates is a very interesting country that almost never gets talked about in comparisons of international health systems, even though its GDP per capita is in the top 10, and they have invested a lot in their healthcare infrastructure. Now, something to understand about the UAE is that there are 7 emirates. They're kind of like states in the U.S. context. 7 emirates, of which 2, Dubai and Abu Dhabi, are by far the wealthiest and are very different in character relative to the other 5, which are more in the backcountry, you could say. So analyzing how the UAE is as a country is actually really hard because the level of data that you can get from each emirate is different. But even with all those constraints in mind, we were very impressed by some of the performance of the UAE. You know, we highlighted already their ability to get their population vaccinated, even though they're in a theoretically vulnerable part of the world. They also are really good on health IT, if I recall, Greg. They've got a pretty good implementation of health IT. They've imported a lot of the best minds from around the world, particularly in the U.S., to help build their systems in the UAE. And that's a country to keep an eye on because it's a country that's growing very rapidly in terms of their economy and where they are doing a lot to build out their healthcare infrastructure. So if I were to say who's a mover in future editions of WIHI, UAE would be one country I'd put on the list, and Israel would be another. That's another country that, in general, is their performance, their economic growth, and the robustness of their healthcare performance has been very impressive. I think that's one that's been off people's radar that ought to be on it. All right. Any other closing comments as we get to the end of the hour here, Mark or Greg? No. All right. Well, I'm gonna hand it to Kara to take us home, if she's still there.
Thanks everyone for joining us today. If you have any other questions about WIHI that come up, you can email me at kjones, that's KJONES, at FREOPP.org, and I'd be happy to pass those along to Avik and the team. Thanks everyone.
Thanks, everybody.
Thank you.